akinesia, bradykinesia, hypokinesia.
Stick your tongue out for me. Can you shrug your shoulders for me?
A man with Parkinson's disease, PD, seen in the morning prior to his first dose of levodopa, his last dose having been 12 hours earlier.
And now
He had lost facial expression, with lips parted, slow tongue movements, and very slow movements of his limbs, left worse than right.
Okay. How about the left hand? Can you? How about the doorknob?
If I think about it, I think I can do it. Okay, once I get going, I think I can do it.
Okay.
It's just so hard to get going.
Yeah. Okay. With your right foot, hard as you can. Now, would you do your left, please?
Pretty good at this.
He was able to rise from a chair, but walked very slowly.
Again?
What is the answer to that? Just tell me. You can just tell me when I get to that right count. The second mile. This line thing is a great invention.
Lift up your shoulders.
A man with signs and symptoms of PD on the right side of the body, including decreased shrug of the shoulder,
Rest like this a minute.
rest tremor of the right hand that reemerges when the arm sustains a posture against gravity, flexed posture of the metacarpal phalangeal joints and extension of the interphalangeal joints.
Twist them like this. Tap the index finger on your left.
Decreased rapid successive movements with finger tapping and decreased finger mobility.
Do that on the right.
Something that I do notice, Dr. Fawn, is with my left hand, for instance, my fingers, 2 forefingers, I can wiggle rapidly like this. Both the toes and my fingers on the right side, I can't. That's about as fast and as far as I can wiggle. Yeah, I can do this, but I just can't. And my toes the same way, I can't.
Interesting twist. This is your handwriting?
Yes, it is.
Handwriting becomes progressively smaller with continued writing.
Stand up for me. Let's see what your walking looks like. We'll go into them.
There is decreased arm swing on walking.
Do any of your patients just keep going?
Postural and action tremor in a patient with PD. This man with PD has a tremor of his hands when he holds the arms up against gravity, postural tremor, and when he moves the arms, action tremor.
Leave it on my finger now. You getting his arm also? Come back.
Jaw tremor, as well as hand tremor in a patient with PD. This man with PD has a pronounced tremor of his jaw. His right hand shows the typical abnormal hand posture and a rest tremor. Masked face and drooling of saliva. This young girl has juvenile Parkinsonism due to Wilson disease. After initiation of penicillamine therapy, she became febrile and had a worsening of bradykinesia. She manifests an expressionless face with drooling of saliva, sialorrhea, due to lack of spontaneous swallowing. The second scene of this girl shows her before penicillamine therapy with rhesus sardonicus, dystonic facial grin. Meyerson sign. Tapping the glabella produces up to 3 blinks in normal subjects, which are then suppressed. But in patients with PD, blinking tends to persist, as shown here. This is a positive Meyerson sign. Apraxia of eyelid
I
opening.
want you to close your eyes for me. Squeeze them shut.
Opening the eyelids may be delayed in some patients with atypical Parkinsonism, especially in progressive supranuclear palsy. Although a misnomer because it is not an apraxia, it has been considered as a dystonia, as freezing, and as levator inhibition.
Good.
Square wave jerks. With the patient looking straight ahead, the eyes are usually quiet. When quick, small amplitude jerks appear, these are called square wave jerks. This patient has progressive supranuclear palsy. Impaired ocular movements.
Yes,
Or you just guess where they are.
I guess where
You can't
they
guess
are.
This patient has progressive supranuclear palsy. She has neck extension, facial dystonia with deep nasolabial folds, square wave jerks, impaired vertical gaze, and normal doll's eye movements.
Up to the ceiling. All the way up. Way up. Look down to the floor. No, look down at your feet. You can't get down?
I can't see my feet.
Tell you what, you see the pen right now?
Yes.
Okay. Look at the pen. Oh, look right at the pen. I have trouble getting up with it too. The down goes pretty well. Maybe you hard trouble to flexing the pen.
Decreased shoulder shrug, decrementing rapid successive movements, and decreased arm swing due to bradykinesia.
Rug your shoulders right up to your ears.
This man has left-sided greater than right-sided PD. There is decreased amplitude in raising the left shoulder and in executing hand and feet movements of the left limbs.
Right hand, make a tight fist, open all the way. Keep doing that. Fast. Go to this hand.
In performing rapid successive movements, there is lack of smoothness, with decrementing of these movements in the left upper and lower limbs.
Left hand. Take the right hand. Tap the index finger nice and big, nice and fast. Left hand. Take the right hand and wiggle those 2 fingers. Pull your arm. Rest the heel of the right foot in a comfortable position so you can tap the toes. Left foot. I want you to fold your arms like this. Show me how you stand up. Good. You put your arms down. Normal walk, don't do anything fancy.
On walking, the amplitude of arm swing is reduced, more so on the left. Decreased rapid successive movements in juvenile Huntington disease. A young man with juvenile onset akinetic rigid syndrome due to juvenile Huntington disease has bradykinesia, including masked facies and decreased rapid successive movements. Overcoming akinesia.
Part of that is very slow. He just catch himself. You can have a seat.
This man has PD and has trouble initiating or maintaining movement.
Having difficulty now in walking and so on.
Yes.
But, if you don't mind,
No, go ahead.
By chasing a bouncing ball, he can move quickly.
You're pretty good with that.
Isn't he amazing? His coordination is excellent.
That is really some demonstration. You learned that on your own?
By bouncing the ball on the floor and going after it, he is able to arise from the chair more quickly.
In other words, getting out of the chair without using that trick, you have trouble doing it.
yeah.
And what about the handkerchief trick?
By purposefully reaching for a handkerchief, he can initiate the movement of an arm that otherwise would be akinetic.
Sometimes my hand, you get stuck here. I can't move it. So I would use this handkerchief to catch it in this way, to move the hand.
Shoulder rigidity manifested by decreased arm swing with passive movement of the shoulders. This is the same man as in video 1-10. He has predominantly left-sided PE. When his shoulders are passively moved, the involved arm moves with the decreased amplitude owing to rigidity. Flexed posture.
I tell you what, take your right foot and stomp the floor. Make a noise.
This woman with PD has pronounced flexed posture of the limbs, neck, and trunk.
Okay. Fold your arms. Can you rise from the chair? Good. You did it. Keep standing, but you can put your arms down. So she is flexed, she's standing. We're going to look at your walking now. We're going to go in the hallway. You walk independently?
Yes, I tried.
Do you need a cane or a walker or
I
anything?
use that since for the past few months.
You have been using a walker. And why is that?
Because it gives me somewhat of a balance.
Go ahead, show me how you walk. You can turn around a little bit. Stand right here. Face me. Come a little closer. Are you standing up as straight as you can? I'm going to check your balance, okay? I'm going to pull you. Try not to fall. Good. Hard. Good. Would you face the other way? I'm going to pull you backwards now. Are you ready not to fall? You understand me? You're afraid? I'm right behind you. You have nothing to be afraid about, but you try to recover on your own, okay? You couldn't do it, huh? All right. We're going to go back now.
Normal pull test. The pull test is performed to assess postural reflexes. This man, the same person as in videos 1-10 and 1-13 with mild PD, has a normal pull test. He recovered with 1 step. Examples of abnormal positive pull tests.
Knock you over. You keep your balance. Ready?
All right.
You can take a step.
This man failed to recover his balance in 2 steps or fewer.
Comfortable? I'm going to pull you this way, towards me. Ready?
This woman's pull test showed more severe impairment. It took a less forceful pull to make her lose her balance.
So I'm going to pull you also, but this time backwards. You can put your feet apart a little bit because you have to recover on your own. Are you ready?
This woman's pull test showed even greater abnormality. She failed even to step backward, retropulsion.
Want to try that again?
Could you stand up, please?
Festinating gait. When walking, this man with PD is leaning forward too much, so his center of gravity is in front of his feet. The result is that he runs, festinates, to prevent falling. He stops by reaching a wall to support himself.
Okay. Come back towards me. Okay, go back towards your wife, please. Do you want her to help you so you don't fall? Okay. Come back towards me.
Freezing when turning and when starting to walk. When walking, this man with PD has freezing of gait, even when other signs of PD have responded to levodopa therapy. In these scenes, the patient is walking in the straight corridor without freezing of gait, but freezing occurs when he turns and sometimes when he starts to walk again. Apraxia.
And now if you would try to do that with your left hand.
This patient has corticobasal ganglionic degeneration with apraxia of the left arm. The left arm does not know how to grab the pen from the right hand. Cortical myoclonus. This patient has corticobasal ganglionic degeneration involving the right arm. The fingers show spontaneous irregular tremor, often a manifestation of cortical myoclonus, and not a true tremor. The examiner brings out cortical reflex myoclonus by applying a sudden stimulus to one of the fingers. Alien limb. This patient has corticobasal ganglionic degeneration. Without realizing it, the patient's left leg spontaneously elevates in the air. He was unaware of this until it was pointed out to him. Blocking tics.
You weren't talking during that bout of movements you had. You didn't make any sounds except grinding your teeth.
Yeah.
Is that common? to have this
Yeah, that's the thing. I sort of.
stop you from talking?
Yeah, I'll be talking to someone, and then I'll just get something else in my mind, and the attention just sort of. I just sort of have to work.
This patient has Tourette syndrome with both dystonic, for example, grinding his teeth, and clonic, for example, repetitive jerks of his right arm, tics.
And it just doesn't come out. Just doesn't come out like my nerves don't bother me that much.
The patient also demonstrates the type of palilalia that is seen in Tourette syndrome, namely a repetition of phrases. When a tic appears, his speech is interrupted, blocked. When the tic ceases, he resumes talking as if there had been no interruptions.
Yeah, but other times I'm not able to relax, and
Catatonia. This 16-year-old youth was found standing silently without moving in the family's kitchen. Because of the differential diagnosis of an acute form of Parkinsonism, he was seen by the Movement Disorder Group. The patient is virtually motionless, yet has spontaneous, normal scratching movements. He does not move on command, but moves easily when guided. There is no rigidity or tremor. Catatonia needs to be differentiated from Parkinsonian akinesia.
If you pull him, he'll walk.
Turn around. Walk. Walk faster.
Psychomotor slowness. This youth was considered to have Parkinsonism because of the expressionless facies, soft voice, and decreased arm swing.
Sunlight strikes raindrops in the air.
But there was no rigidity, decrementing of rapid successive movements, tremor, loss of postural reflexes, or flexed posture.
Okay, the other one.
A fluorodopa PET scan was obtained that showed normal uptake in the striatum.
We get a stand up.
Treatment with antidepressants resulted in loss of the expressionless facies and a return of normal motor speed.
Turn and come back.
I'm going to pull you harder.
Freezing when trying to arise from a chair. This man with young onset PD eventually developed freezing of gait and freezing when trying to initiate other movements.
So all these tricks that you use when you're getting stuck and you're hesitating.
He found that clapping his hands will break the freeze that occurs when he tries to arise from a chair. Freezing when trying to go through a doorway. The same man with young onset PD, see video 1-25, would freeze when trying to walk through a doorway. He learned that dropping to the ground breaks the freeze. Stepping over an inverted cane to overcome freezing of gait. This man has a genetic disorder, Lubag, which is X-linked dystonia Parkinsonism, DYT3. Dystonia was the initial symptom, involving his back muscles. When Parkinsonism later developed, this became the predominant problem, eliminating much of the dystonia. With the Parkinsonism, he developed severe freezing of gait that interfered with his ability to walk. He built an inverted cane that he could step over, thereby avoiding freezing. Freezing of speech, severe palilalia.
Do you go with your friends, or how do you do that?
Well, previously I go with friends sometime. I go over and I don't find any of my friends there. I go.
This man has PD. He eventually developed a problem with his speech, in which the first syllable would be repeated many times before the word could be said. This is a severe form of palilalia and resembles stuttering.
When the sunlight strikes raindrops in the air, they act like a person.
In reading aloud, the palilalia is not present.
White light into many beautiful colors.
Primary freezing gait syndrome.
Start.
This man has no clear-cut signs of PD, only freezing of gait. Eventually, he developed impairment of postural reflexes, and then other features of Parkinsonism. Primary freezing gait syndrome often turns out to be progressive supranuclear palsy at autopsy. It has also been called pure akinesia and gait initiation syndrome.
Okay, turn around. Okay, walk down the hall.
Unilateral rigidity in corticobasal ganglionic degeneration.
From a fall, the right hand, the right side is better than the left side.
This woman has extreme rigidity of the right arm with fixed curling of the fingers. The arm is useless. The symptom began insidiously and slowly worsened. Notice the typical slowly articulated speech with delays between words. This is common in corticobasal ganglionic degeneration and progressive supranuclear palsy.
It's new.
Subacute rigidity, rash, fever, and myoclonus.
This is in all directions with no give.
This 27-year-old man rapidly developed marked stiffness of muscles associated with a rash and fever.
You can see the rhythmical movements as holding his arm. And again, he tends to get contractions all the way up. He certainly has the Hoffman too. Myoclonus, marked increased reflexes. He doesn't have. I don't think he can. He didn't.
Examination revealed sensitivity to tapping the muscles or moving the joints with reflex myoclonus. Previously known as spinal neuronitis, this condition is now called progressive encephalomyelitis with rigidity and is a severe form of the stiff person syndrome. This patient improved rapidly with corticosteroid therapy. Stiff person syndrome.
Hands in the air as high as you can. Lift them above your head. That's it?
That's it.
Okay. Hold your hands out straight.
This man developed marked stiffness of muscles in his trunk, neck, and proximal limb muscles. It was difficult to move the joints surrounded by these muscles. The distal parts of the extremities were relatively spared.
Okay. Flex your head. Touch your chin to your chest.
Make change. What, with my hand?
No, bend your neck forward like this.
No, I can't.
Bend it backwards. Okay, fine.
Stiff baby syndrome.
It wasn't my thought. Increased 36 hours of life.
This neonate goes into muscle spasms when the body is touched. Breathing can stop, owing to prolonged muscle firing, so continuous stimulation should be avoided. Although named stiff baby syndrome, this disorder is due to hereditary hyperexplexia, a startle disorder. Even in utero, the fetus has spasms of the muscles.
It wasn't explored here, but that's she wasn't born here.
It's just something I've heard.
No, that, yeah, you definitely see that, and you see it in hyperactive.
Abdominal dyskinesias.
Now, how about lying on your stomach?
Continual movements of the abdominal muscles have been called belly dancers dyskinesias. The patient seen in this video had back trauma and then developed these abdominal movements. To differentiate this from psychogenic movements, poly-EMG was carried out that revealed a spread rostrally and caudally from a spinal segment, firing at a physiologic rate. This led to a diagnosis of spinal myoclonus in this patient. Acathitic movements. This man has truncal rocking. He crosses and uncrosses his legs and touches his cap repeatedly with an urge to jump up out of a chair. He had been exposed to dopamine receptor blocking agents and now has tardive akathisia without other signs of tardive dyskinesia.
Do you feel that you're troubled at all by a feeling of restlessness?
Yes. Yes.
What does that feeling make you do?
Jump up. Like that.
Uh-huh. Do you do that often?
Yeah.
Are you able to sit through a meal?
No. Sometimes I have to go and lie down.
Acathitic movements associated with tardive dyskinesia and moaning.
Oh! I'm getting worse.
Getting worse? You feel very uncomfortable.
Yes.
Is it worse just to sit still?
Yes. I have to keep running.
You have to keep moving around?
Yes.
What about lying down?
This woman had been treated with antipsychotic medication and developed tardive dyskinesia. Observe the mouthing movements. In addition, she is restless. She describes this symptom as being unable to sit still and having an urge to run. With this tardive dyskinesia, she has moaning, another way to express her discomfort. Cerebellar ataxia and acinergia.
Between your nose and this pencil. Now, slowly touch your nose and the pencil.
This man has a family history of cerebellar ataxia. It developed in this patient in adulthood and slowly progressed. There is a decomposition of limb movement, acinergia or limb ataxia, missing the target, dysmetria, titubation on standing, and a wide-based gait. He usually walks with 2 Canadian crutches to maintain his balance.
And you can see on walking how wide-based he is and how easy it is for him to fall.
Athetoid cerebral palsy.
Looks like he's quieted down a little bit.
This child developed chorioathetosis due to perinatal difficulty. His limbs, trunk, and neck are continuously moving in a flowing fashion, but slower than is seen with chorea.
Okay, step back a little further. Okay.
Hemibalism.
Hell. Very. Ouch.
This woman suffered a stroke involving the left subthalamic nucleus. The initial weakness was followed by the continual flailing movements of the right limbs. These hemiballistic movements are large amplitude choreic movements and are present at rest. With active voluntary movement of the affected limbs, the movements can be partially suppressed.
Doctor, I don't want it.
Huntington disease. This man has Huntington disease with its characteristic choreic movements. The movements are brief, with an appearance of flowing from one body part to another. Note particularly the chorea in the forehead and relatively sparse movements in the lower face. The opposite would be typical in tardive dyskinesia, which also has a more rhythmic quality compared to the random nature of the chorea that is seen in Huntington disease. The patient has other features of the disease, such as his disheveled features and irregular gait.
Put your arms straight out like this. Both hands right out there. Just keep them right out there. Okay, spread your fingers a little bit apart like that, like a fan. That's it, just like that. Okay, and just walk back and forth. Back into that corner there. Back and forth. Back to the chair. And back all the way over into that corner. Keep right on going.